Hello everyone. Today we'll discuss about fever. Okay, the normal body temperature is around 36.5 degrees centigrade to 37.5 degrees centigrade. So in fever, we know the heat will be produced. It will be produced mainly from where? In the metabolism that occurs in muscle, liver. Okay, and then the heat which is produced in our body, that is released through the skin and lungs. Okay, and we also considered the temperature of a body as if and if is as a fever when in AM if it is more than 37.2 degrees centigrade, in PM it is 37.7 degrees centigrade. If it is more than these temperatures, we'll consider it as fever. Okay, in normal our circadian rhythm, the normal daily temperature it varies around 0.5 degrees centigrade, and we know that our rectal temperature is around will be more than the oral temperature, that's around a scale of 0.4 degrees centigrade. Okay, now we'll know about what is actually fever. It is a elevation in the body temperature that exceeds the normal daily variation, which we saw that as 0.5 degrees centigrade, and with increased hypothalamic set point. See, if hypothalamic set point increases, then we will get fever, and if it decreases, what happens, we'll see then next. Okay, see, first if you see hypothalamic set point is raised. So what the thing occur? If it is raised, fever will occur. How? The mechanism will see, the neurons which are there in our vasomotor center, they will be activated. See, vasomotor means they mainly if they are activated, they causes vasoconstriction. So what happens here is the blood which is flowing in the periphery comes to the organs. So what happens? Decreased heat loss, because heat is lost to the skin. So if peripherally if it is no blood, how the heat will be lost? So the heat loss will be decreased from the skin. Then here, if the blood is coming, if the blood is not flowing through the skin, the decrease in heat loss is seen. So then the person feels cold. You observe, when you get fever, you will feel chill because the blood is flowing from periphery to the internal organs. Next, this causes fever. Another condition, when the hypothalamic set point is decreased, here what happens? Opposite to that of increased hypothalamic set point. So what and all occurs? Vasodilatation and sweating, the initiates. Here what occurs? Heat loss will be seen. So until what the set point is set, no, that the blood temperature at that much of heat loss is seen, then it will be same, normal. So we'll see fever and hyperpyrexia, they are not same, they are different. See, fever, if it is more than 44.5 degrees centigrade, it is called as hyperpyrexia. Here central nervous system hemorrhages are seen. Okay, we'll see difference. In fever, the skin will be cold. You know actually what I said. And in hypothermia, there is a more increased temperature, but they are rapidly fatal and they don't respond to antipyretics, but fever responds to antipyretics. Okay, we'll see some agents that cause fever. They are called pyrogens. There are some bacteria and chemical mediators. The bacteria are gram positive, positive like mainly lipopolysaccharide, and gram negative like staph aureus, group A B streptococcus. They are also called as super antigens. Remember this thing. Next, some cytokines. They are chemical mediators. These cytokines helps in media process of processing immune system, inflammatory system, and hematopoiesis. So they are mainly interleukins 1 and 6, tumor necrosis factor, and ciliary neurotropic factors. The fever which are caused by inflammatory responses are like pericarditis, like inflammation of your pericardium, and any trauma, any strokes, and routine immunizations like giving vaccinations. During that time, you observe the temperature will be increased. Okay. So see, during fever, the hypothalamus and third cerebral ventricle, here the PGE2 levels will be increased. This increases the set point. Okay, if PGE2 levels are increased in peripheral tissue, they cause myalgia, arthralgia. You see joint pains, muscle pain. If they increase, these are seen when the PGE2 levels in the peripheral tissue is increased. Okay, if that they increase in the brain, there what happens? Hypothalamic set point will be increased, as I explained earlier. Okay, see, finally we'll see one grasp or overview of what I have explained. Mechanism. See, the infection may cause, microbial toxins may cause fever, or mediators of inflammation may cause, immune reactions may cause. Okay, these are mediated through production of chemical mediators by what cells? Monocytes, macrophages, endothelial cells. You can see. Okay. Then these pyrogenic cytokines, what they will cause? They will enter into the circulations and they increase. They act on hypothalamic endothelium. They release a PGA2 levels, and this causes the cyclic AMP to increase the thermoregulatory set point. This causes heat production and heat conservation. Heat conservation how? Just by flowing the blood periphery to the central into the internal organs. That causes the fever. Okay. Thank you guys. If you like this video, I will make a video on treatment of the fever. Okay. Thank you.